What's interesting, John Lott, is that we've heard from President Biden now still calling on him to resign, other top Democrats as well. How much of a political challenge is this for Andrew Cuomo?
I mean, the interesting thing with Biden is he has the same skeletons in his closet. I mean, we have 11 women who have been accusing Andrew Cuomo of inappropriate touching. We have 8 women who accuse Joe Biden of that or worse. And these are Democrats. Many of them worked for Biden. Tara Reade accused Biden of rape. So I guess my question is, why isn't the press then saying, okay, if Cuomo should resign because of this, why shouldn't there be an investigation into the charges against you? Why not ask the University of Delaware to finally release some of the documents dealing with Tara Reade's employment for Biden during that period of time? But, with regard to Letitia James, one of the things that kind of muddies the water here is that she is going to be running for governor this next year and going to be an opponent of Cuomo's. So, it's kind of interesting just to see the way the media has been treating her comments.
John, I'll bring you into it because it does indeed hurt the argument that COVID is top priority when you look at the crisis at the border, and it indeed is, in fact, a crisis. The White House says they support local officials in putting in their own mandates. This obviously would be from a federal standpoint. If you care that much about Delta variant, now Delta Plus, which we're hearing about, Lambda variant, and others, this, what you're seeing, hurts your argument of these record numbers coming over, John Lott.
No, I agree completely. Look, you can look at the vaccination rates for Latin American countries. You're talking about single digits. Many of these countries have low single-digit rates that people are being vaccinated. The people who are coming over probably aren't even in that low single digits numbers. And so, if they're actually going to be sending people back who have not been vaccinated, they'd have to send back virtually all the adults that are coming across, and they're not obviously doing that. But, beyond that, there's a bit of hypocrisy. They're saying they're going to let local officials have a say, but yet the Biden administration is suing the state of Texas because Governor Abbott has wanted to go and check the migrant illegal aliens that are coming across for whether or not they should be held because they may have COVID. So, on the one hand, they say they want to send people back, but they're not. And they're also saying they want to let local governments have some control, but then they go and sue them when they try to go and have that control.
Right. All right. I got to leave it right there. I'm out of time. John Lott, Andrea Kaye, Ken Cuccinelli, stay with us. More to talk about.
This headline in. This is from the New York Times reporting the FDA aims to give final approval to Pfizer vaccine by early next month. Of course, we know at this point it is emergency use right now, but perhaps this move could kick off more vaccination mandates for maybe those hospital workers, college students, federal troops. John, your thoughts on this headline and potentially getting fully authorized?
I mean, the big problem that the administration's had is they've already been caught letting politics get involved in things like decisions involving schools. The CDC was in discussions with teachers' unions, for example, on whether they should require, kids getting back to school or whether they should have masks. There's no reason why the teachers' union should be involved in those types of decisions. Look, I do data a lot. And if you look at the data here, it's really hard to go and see any of the types of recommendations that are being made by the administration. The rate that people who are vaccinated go and get this virus is like hundreds of 1 percentage point. People who, even those who get it, as Ken was saying earlier, aren't getting severe cases. The death rate is essentially zero for those individuals. When you look at the UK, which has already gone through the Delta version of this virus, they had their big increase about 2 months ago. There's been essentially no change in the deaths that have occurred in the UK. The line afterwards, even 2 months after the surge began, there has essentially been flat. And one of the things you see in terms of the mixed messaging is that now the Biden administration and the news media is talking about number of cases. Well, there's a reason why they're focusing on number of cases and not number of fatalities, because you're not seeing a change in the number of fatalities. And so,
thankfully, that's the case. That is so true, and we make great points. Again, look to the data, right? That's absolutely, that cuts through all the confusion right there. John, Lott, Andrea Kakin, Cuccinelli, out of time for this segment here, but we've got some more to talk about coming up.
Happening right now, development, go ahead.
Look, John is on here is the king of data, and he mentioned following the data before. And one of the things that gets talked about so little, and thankfully you all touched on it earlier, is whatever cases are coming right now, look at the outcomes of the cases. This is radically different than a year ago. And that's really very important when you're deciding what public health policy should be. One of the biggest errors in the last year and a half have been made by policymakers who looked at nothing beyond the virus. If you lock down people in their homes, they can't work. Their kids can't go to school. We have children all over the country who lost a year of schooling. And that's worse the poorer you are, and that's disproportionately minorities, of course. So you've got to take into account all those other factors, and it starts with really how dangerous is this? Thus, Ron DeSantis' comment, would I rather have 500 old people get this or 5,000 young people? I'd rather have 5,000 young people because it doesn't do much to them. Now, that doesn't mean absolutely nothing, but that kind of data has been absent from this discussion, and the White House has been completely ignoring it.
Yeah, and Ken, to your point, we've seen a lot of sort of blanket approach when it comes to dealing with COVID. And of course, these are very diverse U.S. states that we live in. They're different, quite frankly. If you live in New York City, you're living on top of each other, you're renting out apartments for a lot of residents here. That's not the same in different states across the country. If you're in Kansas, you might have your own space and your own backyard as well.
It's hard to take them seriously of criticizing Texas in particular when they've literally opened the border to anyone untested to come in from countries that, as John pointed out, have almost no vaccinating going on.
And John, too, even when you think about international travelers as well, even if you're vaccinated and you want to come in and visit from the UK or Europe, you still can't do so. But it's different at the southern border, right?
Look, it's hard to make any sense out of a lot of the rules that are there. Obviously they're being very inconsistent. I wish somebody in the media with regard to DeSantis and Biden would go back and just see who was right over the last year and a half. Just compare. Look at the statements and recommendation that Biden made. Look at the policies that DeSantis actually instituted, and just count up who was right and who was wrong. For Biden and his press secretary to go and attack DeSantis for supposedly making decisions based on politics rather than on the science, I think that would pretty quickly show who's the one who's been relying on science there. But I agree with Ken. It's amazing that they go and point out Texas, which I guess has most of the coronavirus cases. And you're looking at this and they're preventing Texas from even doing a few things that they're able to do to try to corral people who are being let through. But it's not just that. They're letting people into the whole rest of the country. They're using the military and private buses to go and ship people who are coming across the border to the rest of the country.